Good morning.
Good morning.
How is everybody today?
Awake.
Uh,
I
well, it is, I don't even know what time. It's 9 o'clock. We
yeah.
always do our calls nice and early on Family Day. It's actually Family Day in BC here today, which is super exciting. And both of us have families outside playing while we're inside working. Short-lived. We just want to meet with you guys today for about 15 or so minutes just to have a little power conversation on the topic of posture, confidence, and pain and the overlap between these three things. So we just wanted to jump right in. We're
Sure.
going to go over when you look at your little children, whether they're infants or maybe they're grown adults now, but if you could probably remember the days when they were really little, and most children move so beautifully and they carry themselves so beautifully. So they sit upright when they're sitting at a table or they're watching something on a TV or reading a book.
They've got perfect squats, like their hips, their spines can stay like upright. They don't collapse forward. Yeah.
They're like amazing to watch. They crawl well, they roll well,
they run well.
They run well.
Climbing, like when I taught climbing, you never have to teach kids. They just know how to do it. It's just get out of their way, basically.
Yeah. And so San and I have talked a lot about this because this is a really powerful topic for us, especially having daughters. And this is relevant for sons as well, but especially thinking about us as women and now as mothers. Mm-hmm. We start upright, and then often when we hit puberty, we start to become self-conscious, whether it's from our breast developing or it's just from the things that start to come up in our lives as adolescents. And so we start to become smaller as girls. And that often doesn't shift, unfortunately, unless we're very conscious about opening ourselves back up. And Sonia, we were speaking about this, how this is often, how tall are you?
5'1", somewhere between 5'1" and 2.
She's like a little powerhouse and not super busty.
Nope. Well, when I was pregnant, I sure was. When I was when I was nursing, yeah. No, and yeah. So I have the opposite problem, but I've noticed I naturally can stand, like, I feel comfortable, and I'm often trying to, like, maximize my height, so I'll stand as tall as I can. I'm trying to maximize my bust, so I'll, like, stand as proud as I can, but I've noticed other women, that either who are tall, if they're tall, I kind of feel like they kind of have to come down so they're a little bit smaller with the rest of the women, or busty women kind of hiding a little bit so they don't stand out quite as much. But so, and it's so interesting what that can do. I mean, physiologically, if all of us kind of collapse in around our chest and our breasts, and just notice how your breathing changes. Like, how do you feel? Any feelings that come up? Like, I know I can start to feel kind of anxious. Like, there's just this kind of icky, like, feeling. So it's really fascinating to see the connection there between, the psychological and the physiological that happens from the change in our posture.
Yeah. And we're going to talk about like what correct posture is in a moment, but maybe this is a great time, Son, to mention how we've seen the work of Dr. Amy Cuddy, and she's a psychologist, and her work is basically using what's called power posing now. She's coined this term for the idea of assuming a large position. And when we assume a large position, it actually changes our physiological state to the point that our confidence will be increased. Cortisol levels, they say, go down. Testosterone levels go up. So it's actually beneficial to be able to take a large position for, I think it's 3 minutes. Somewhere around 3 minutes.
I'm going to do it. And I'm going to invite anyone who's listening right now, if you're sitting, you want to just see how you feel in a few minutes just from taking a good stance. Do you want to talk me through some posture?
Yeah, so you could do a power posing, like a really big one would be like this, like going into a bathroom before a presentation or anything you need to do to kind of get big. So it's literally, this would be the maximum wide stance in your feet, arms out. Yeah. Simple things though, even just like sitting in a chair and getting your arms out. If you notice often men and women, if they're on public transit, for example, women will sit small, cross our legs, we get little. Men often like are very comfortable taking space up. Legs are wide, arms are out.
Yeah, and I've actually noticed, I was in a meeting last week and I noticed it was like, ooh, bad choice of clothing, because normally in meetings I can sit really like, I don't even think about how I'm sitting because I usually wear pants, but I was wearing a skirt or a dress or something and I noticed like, oh man, I can't even sit the way I want to. I have to like kind of keep my legs, my knees together, and it was distracting, and it's really interesting. Like I could feel the change in my presence and my confidence.
Yeah, and we've talked about this, like making sure you're wearing clothes that you feel comfortable in to move and let your body be in its natural state too. So even aside from the confidence side, just from a physical side and from a neuromusculoskeletal side, it's so valuable to be wearing clothes that let your body be in a comfortable position, because so many clothes make us feel like they actually pull us down.
Oh, yeah.
Had that incident with your jacket that you felt was a bit...
I know, yeah, that's right. We had our first podcast that we did together, I was wearing a Lululemon jacket. Well, no offense to Lululemon, it was a kid's size. That's probably why I shouldn't have been wearing it. And it was just too damn tight. And then I went, and it held me in this posture so that when I went to open and stretch, things went wrong. Things went sideways.
Pec pull. A pec
Yeah,
stretch.
it was a pec pull. But it's interesting to think about, like, at what age did you start wearing a bra, or did we start wearing bras, and like that even impact, like that tightening and constriction around our rib cage, limiting our breath, and possibly straps pulling, or in different ways too. So we're wearing these different like props basically that can really change our posture and our position.
Yeah, so choosing things that are the most comfortable for you. So, so basically, going back to the power posing, this is something that you can use in your life to help improve your confidence, make you feel stronger, bigger, bolder. Actually, you make you feel strong as a mother. This is a local Vancouver company doing this, so very cool. Strong as a mother shirts. But make you feel bigger and awesome and confident with what you're going to do. And then we were saying the other day, Sonia and I were saying, this is a cool thing that we can do with our kids. Like if they're feeling fearful or they're feeling anxious, let them feel the difference that happens in their bodies when they get big and they aren't so timid and shy and fearful.
Yeah.
So try it out when you're feeling like you need to be a bit bigger in your life and more confident. And so let's talk about actually like posture right now, what we want to see with optimal posture.
Yeah.
So we've overlapped this. If you haven't watched the breathing podcast or video, please check that out, because that one's really valuable for going over some of this as well. So if you're looking at Sonia straight forward, we're going to see that there's a stacking of joints that start at her feet, which you can't see, but that's okay. We want to see that our feet are not collapsing inwards, that we're kind of lifting through the inner arches. And then that kind of lift or strength will carry up through the inner thighs to have Sonia's hips stacking over her feet and her knees, and then her shoulders will stack over her hips and her head will stack over that. So Sonia, from the front, that's great. But if we turn her to the side, what we want to be able to see, and this is the big part here. Yeah. So there's the overarching of the lower back, which is so common for most of us, especially after having carried babies. So what we need to do is find parallel between the rib cage and the pelvis.
Okay.
And when we see that there's a parallel line there and not a scissor opening, which is, so Sonia will show you a scissor opening, that's what happens. So our rib cage and our pelvis open. So it's like if your pelvis was a bowl of soup. Right now, all the soup is pouring out of the front of the pelvis, and Sonia's rib cage is popping up. So what we need to do is get our core back on by bringing our scissors back into alignment, into parallel. And when you do this, your baby belly, post-baby, if you're a new mom, is going to start to minimize itself too, because now your core is going to be actually turning on.
Yeah, it's interesting. I can feel like the backs of my legs turning on, like I really can feel like the strength in my legs as well.
Yeah, and then your butt turns on. Like Sonia has a nicely developed tush, and so you can see her behind looks like.
Is that what you're in? Was that the cue?
That was the cue for the funny dance move. Yeah, well done. Son has like a more protuberant behind. And so it depends on the shape of your butt too, with what your back kind of almost looks like. But make sure that you look the difference between your back and your butt. It's not that shape in her lower back is there, but it's also because of the shape of her bum. So you want to find neutral for your body shape, and that's a matter of where your rib cage is positioned to your pelvis or your pelvic floor.
Right.
Yeah. And then the last thing here is this, watching the shoulders so that they're from the sides on, if you're looking, that the shoulder's not rounding forward tremendously.
Okay. So I will round forward for a bit.
And so we want to see that the shoulders are in line, like they're not focused on really pulling back. A lot of people these days are really squeezing back. We don't want that. We want to focus on down.
Pops the ribs forward.
Exactly.
Yeah. So I like that. I like the cue of the holding the paint cans.
Mm-hmm.
Yeah.
Yeah, that pulls you down in your neutral. And then as you start to open up through your chest and your back gets stronger, your shoulders will creep back into the proper, like, ideal alignment. And then the last thing from the side, one more thing, San, is your head. So we want to make sure that her head is not living out in front of her body. Her head is stacked over her body. Yeah, cool.
Okay. Now I feel powerful, so powerful. I'm going to get the sword.
It's a sword in her room. I love it.
Yeah. We like to slay the work in the office.
Ninja.
Yeah.
Yeah, and then so the thing we wanted to get into here is pain, like how when your posture is poor and your confidence is down, perhaps, even if your confidence isn't an issue, but like sometimes it is, so just recognize the correlation, but bad posture and pain, like how many people have tight neck muscles, like shoulders, like all up and through the back of their necks, like mid and upper back, low back.
Mm-hmm. Yeah, lots. So what do we do about it?
So we can start working on our posture with those few things. So watching.
Yeah, so how does all of that happen? Like, so why is the posture or like the pain in the neck and the upper shoulders and the upper back, like how is that related to what we were just discussing?
Yeah, so to keep it simple, basically what happens with most of us is that when my daughter stole my microphone base, so now I'm using earphones today, so I'm attached. But the idea is if we're too arched through here, the low back muscles are going to become shorter. Mm-hmm. So even if you want to play with it in your own body, take your thumb and your index finger and put them on your lower back.
Yeah.
And now arch your lower back, and you'll notice your fingers get closer to one another.
Yeah.
And now go in the opposite direction, so tuck your tail under, and you'll notice your fingers become longer. Uh-huh. And so the same thing would happen in the front of the body if you're putting your hands on your hip flexors, like in your abdomen. Yeah. If you're tucking under like this, or you're in your lower back curve, your fingers are going to be closer together, and then as you stand up, your fingers become longer between. Right. So that's just a cool indication of what's happening to those muscles, right? So when you're in your lower back's really arched, your lower back muscles become quite short, and your hip flexors become quite short. And then the same thing happens on the front of the body. So this here, if you were looking at your shoulder to your sternum, and you're fully forward, now those fingers become closer together. Yeah. And
so the soreness then that I'm feeling in my upper back is actually not from an overuse of the muscle. Is it from the lengthening? Like the muscle there is actually stretched.
And it doesn't like it to be in that length.
So it's like you feel like, I know that there's that feeling like, oh, my muscles are just so tight. I need to stretch them out. But truly, it's not that they're so tight. It's that they're overstretched already.
So you stretch the opposite side of the body, and you'll start to get the relief on the symptomatic side. So often the symptomatic side is not necessarily the tight side, as they feel tight, but they're in a long position, and the muscles don't want to be longer, like you said, than they should be. There's a natural state for all muscles. And then the problem is that when those tight muscles exist, you need to find strength or activity, like and then sometimes the muscles are inhibited on the other side, and then we need to re-engage them. So for example, going back to this situation again, so when we're in this lower back curve, these are tight and the hip flexors are tight, and then the abs are sloppy and not turned on, and the butt is sloppy and not turned on. So the two areas as women, like from an aesthetic perspective, that we're most concerned about, butts and bellies, if we correct that pelvic posture alignment, then it does so much for turning those muscles back on. There's exercises and stuff to work on that, but that's a big start of it, a big piece of it.
Yeah, cool.
Yeah. So same thing in the upper body, and then same with the neck. So the neck goes forward.
Yeah.
When our head goes forward, these little muscles in the neck, they'll actually pull us up into this position, because if our head goes straight forward, we don't want to it pulls us forward and slightly down. We don't want to be moving through the world look like this. We want to be up like this. So now we're coming up, and now these muscles in the back of the neck become super tight. They're called the suboccipitals, and they become really tight, and they provoke headaches and blah, 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 all that stuff.
Yeah. Wow.
Yeah.
It makes me want to move. It's it's just when you sit and hold a position for too long, what your body starts to take shape is really fascinating.
Yeah. So Sean, tell us, you have some great things that you do at your work throughout the day to help keep your body moving. So do you want to share some of those with us?
Oh yeah, sure. Yeah. Well, I've just gotten into, so I have tiers, kind of like this. So because I work at a computer. So this is kind of home office, but at work office, I have tiers so I can move between different levels. So say I'm sitting on a ball, which is pretty sweet. At work, I have kind of a wobbly disc, but very often I'll change position. So I'll stand up and I'll move my computer up to a better height and move my keyboard up. This office isn't the greatest for me. I'll do different things to get my foot up, somewhere to the side, or often I can be found working in the office and squatting or down on the ground. I just move into different positions, and yeah, so as much as possible moving around. And also the other thing too, we don't think about exercising or posture. Maybe I don't know about posture of your eyeballs, but another thing, we don't take for granted your eyes when you're moving, because those muscles. If you imagine sitting at this kind of distance all day, and what's the furthest point that you can see in your office or in your house? Maybe 20 feet, depends on the size of your house. But as much as you can, either get outside or look out a window and look somewhere as far as possible, just so that you give your eye muscles a chance to move and to exercise.
That's a good point. And so then you also have, you work in a unique work environment too, where it's very open to be able to move throughout the day. So do you want to maybe give people some ideas of things that they could do if maybe they're in a little less of playful an environment, or things that they could do to help get moving throughout the day if they don't have this desk situation?
If you don't have a desk situation, then change your situation. No, seriously. I mean, it's we know sitting is the new smoking. So it's not something to take lightly. Honestly, you need to get up and move. But yeah, just look for opportunities to move your bodies in different ways. Even when you're getting just you choose it. I go crawl under my desk every day to plug my computer in. It's oh, this is neat. I actually get an opportunity to crawl and move around. I remember seeing you post something about this, walk backwards, go from your door to somewhere else. You might get kind of funny looks, but you're thinking about incorporating movement. And if possible, I haven't been as great about this lately, but you can set an alarm as well on your computer or a timer if you follow the Pomodoros, and you can actually, Pomodoros is a work technique where you work concentrated for a length of time, and then you take scheduled regular breaks, and then after a certain number of those, it's reps, then you take an extended break. But that type of thing actually helps to make movement a more regular part of your day. Do you have any other recommendations?
No, I love that you suggested the Pomodoros. Sonia's been always so great. They used to do really playful ones in their work environment too, where they would actually make a challenge to do crazy stuff like jump from one desk to another or stuff like that in their Pomodoros, but they had an environment in which they could do those sorts of things.
Yeah.
So I think it's also an opportunity to be a leader in your work environment too. So if you're in a place where it is a little bit more rigid, perhaps there's a way that you can gather people together and all work together to create change so that it's not weird to be the one who's doing this strange stretch in the office or things like that. We're in Vancouver, so I get patients from Lululemon as well. And then in that environment, it's so easy telling people, go try this, go try that. And then in our environment, it's totally natural for somebody to be busting out a yoga pose or do something different. So yeah, I'd say try to make it normal in your office to move, whether it's even something stretching or take a big like power pose, which is going to get your arms up to the ceiling. You're going to stretch through your lateral bodies. Yeah. When you stand, it decompresses your spine. So reaching to the sky. It doesn't have to be a crazy cartwheel, but it can be something as simple as a big stretch to the sky every 20 minutes or walking around your desk or making sure you walk to the bathroom even if you don't need to walk to the bathroom.
Yeah, and taking walking meetings. If you have that opportunity, if you don't have to be tied to your computer and you have meetings where you're just talking with people, it's so great. Go for a walk.
Yeah.
Yeah.
And then maybe we'll just wrap with the idea that as parents, if you are on a mat leave, or it's the evening or the weekend or the morning when you're with your children, just recognize how grateful we should be for the movement our children bring to our lives. Because if you've probably recognized the year that you're with your child, if you're in Canada, we're fortunate enough to have a year off. It's during that time that you'll probably have the least amount of postural pain in your body because you're forced to move into different directions and positions all the time with your children and you're not fixed to a desk. So just actually being grateful for your children to keep you moving, just a nice point to reflect on during those moments that you may feel a little less grateful for frustrations and stuff. Yeah. So keeping it all in check. So anything else you want to mention, San, before we wrap?
No, that's good, Car. Thanks.
Cool. So walk away from today, checking your scissors, making sure your hips and your pelvis, your ribcage and your pelvis are neutral. Just keeping everything in line. So thinking about being as tall as you can, like a string lifting you from the back of your head up to the sky. Getting big.
Do it.
Getting big.
Get big.
And check out Amy Cuddy's TED Talk. It's awesome on power posing.
Sweet.
Cool. Right. Thanks, San.
You're welcome. Thanks, Carla.
Bye, guys.
Bye.